you sick yet? The kids have been in school less than a week, but you may already be dealing with sniffles and sneezes. But there are ways to build your immunity and ward off those germs. Dr. Glenn Rapsinski, a pediatrician and an infectious disease expert at UPMC Children's Hospital, Pittsburgh, has some tips for parents, and boy, do we need them, because I'm telling you, I don't know what it is, but all of a sudden they're back in, the windows are still open, and the germs just start spreading.
Yeah, the germs don't take too long to pass themselves around when it comes to being in a small space like school.
So let's talk about some of the most common school illnesses that we see, or among school-aged children.
Yeah, so the most common things we see, especially in kids who are in an enclosed space like a school, is the respiratory viruses. So these are your common cold viruses like rhinovirus, the flu virus. Once that starts circulating, will be circulating well in schools, as well as COVID and other coronaviruses. In addition to that, the acute viral gastroenteritises, so those viruses that cause vomiting, diarrhea, will be coming around as well. And strep throat also can pass around in schools pretty easily.
The stomach bug too, I have to ask, because I know that sometimes things can mutate a little bit, but these stomach viruses seem to be no joke, and I feel like they are spreading so quickly anymore.
Yeah.
We're just hearing about them in like these waves, even into, I think it was April and May of last year, we were still seeing them.
Yeah, so the stomach viruses in particular are very difficult for us because some of them actually hand sanitizers don't work for. You have to actually use soap and water to wash your hands in order to really eliminate those from the system. And kids are just not necessarily the best at doing that, and so after they've gone to the bathroom, they are more likely to track that virus around.
And they are like little germ factories, because even if you tell them to wash their hands, they may not be doing it as well as they need to. And even teaching them, you know, the Dracula cough and sneeze trick, they still don't necessarily do it as well as they should.
Yeah, I would say my 4-year-old nephew has done a great job at learning the Dracula cough and sneeze, but I have watched him wash his hands, and it isn't always the best.
You're like, and that's why we're all sick again. Got it. So what can we do? I mean, aside from teaching our kids good hygiene and how to properly cover their mouth and nose when they're sneezing and coughing, what can we do as parents to build our immunity and help our kids build their immunity?
Yeah, so the best thing that for building up immunity is really kind of hitting all the points that the immune system needs. So you need good nutrition in order for your immune system to work the best that it can. And so I'm not necessarily advocating for a multivitamin or anything like that, but good diverse diet is a good way to get all the vitamins and nutrients you're going to need to have a good immune system. Sleep is also vitally important for the immune system, because when you sleep, your body is helping communicate around the immune system what's going on, using particular signals that are in the body. And then, you know, anything that is stress related. So for all of us who are adults as well as kids experience stress just as much as adults do. You know, trying to relieve those episodes of stress, try to take those times for relaxation, both with the kids and yourself.
And I know, you know, it can be a little cumbersome when your kids get sick to try and figure out, when do I take them? When do I call the pediatrician? So what is a good rule of thumb when you should notify your pediatrician? So
I think it's always a good idea to touch base with your pediatrician if your child's having a fever. If they don't feel like you need to come in to see them, then they'll tell you not to come in to see them, or they'll say, you know, wait a couple more days, see if the fever goes away. If they're having difficulty with their breathing at all, that's obviously a good reason to go see the doctor. Or if you're noticing any redness, swelling, or just them not really eating as well as they need to, you feel like they're getting dehydrated, that's always a good reason to go see your doctor.
You mentioned some of the respiratory viruses, and I know RSV can't be as serious in older kids, and there's some good conversations too about vaccines, but how important are the vaccines for kids? A lot of schools are requiring them now.
Yeah, so certainly all the vaccines that we advocate for in the young population are really specifically targeted with the dose timings in mind, because those are the times when kids are going to get most severely ill with them. So you'll hear a lot of people talking about changing the vaccine schedule, and that's really not the most appropriate thing to do, because then you're going to put them at more risk for those serious infections when they're younger. During their school age years, really it's all about getting the repeat flu shot every year, as well as getting any COVID variant vaccines that the CDC is going to be recommending. All
right, thank you so much. And you're sticking around, you stick around too, because we're switching gears to talk about a new COVID variant that may be able to dodge your body's immune defenses and is being closely tracked by the CDC. That conversation is coming up next.